Imagine waking up one day with a pounding headache, a fever that won't break, and an extra stiff you can barely move. It feels like the flu, but worse. And no matter what you try, it only gets more intense. What if I told you that these simple symptoms could be hiding something far more dangerous? That's the reality of spinal meningitis, an illness that can take hold fast and spiral out of control if left unchecked. The hidden threat behind common symptoms. Meningitis often starts with what seems like everyday problems: fever, headache, and a stiff neck. But here's where it gets tricky. Unlike the flu, meningitis targets the protective membranes around your brain and spinal cord, and that makes it a whole different ballgame. Early on, it's nearly impossible to tell the difference. But the stakes? They couldn't be higher. The symptoms may worsen rapidly, leading to confusion, seizures, or even coma. It's a race against time. Diagnosis and treatment can mean the difference between a full recovery and long-term complications like brain damage or hearing loss. So, how can you tell when a regular fever is something far worse? Let's break it down. Recognizing the early signs. Meningitis doesn't announce itself with a grand entrance. Its symptoms sneak up on you, mimicking more common illnesses. Here's what to watch for. Fever over 100.4 degrees Fahrenheit, 38 degrees Celsius. Not just a low-grade fever that makes you a little sluggish. This is the kind of fever that grips you, burning and relentless. Headache, but not your average tension headache. It's intense, piercing, and different from any headache you've felt before. Stiff neck, making it almost impossible to turn your head or move comfortably. Nausea or vomiting, making your whole body feel off. Confusion or an inability to concentrate. Suddenly, the world feels like it's slipping away from you. Sensitivity to light, bright lights become unbearable. In some cases, a skin rash, which often appears with meningococcal meningitis. And for infants, who can't describe their discomfort, you might notice irritability, excessive sleepiness, or a bulging soft spot on their head. As subtle as these symptoms might seem at first, they can escalate with terrifying speed. What causes spinal meningitis? Now, let's get to the heart of the matter. What exactly causes spinal meningitis? The answer isn't simple because it can come from multiple sources, but the big four are viruses, bacteria, fungi, and parasites. Viral meningitis. This is the most common and often the least severe type. You've probably heard of viruses like herpes simplex, mumps, or West Nile virus, right? These same viruses can sometimes cause viral meningitis. While it's not usually life-threatening, it's still an illness that can knock you out for weeks. Bacterial meningitis. This one is the most dangerous. In fact, it's a medical emergency. Bacteria like Streptococcus pneumoniae or Neisseria meningitidis can invade your bloodstream and reach your brain in hours. This type can lead to severe, long-lasting damage or even death if not treated immediately. Fungal and parasitic meningitis. These are rarer, but they tend to strike people with weakened immune systems. Think about a fungal infection getting into the bloodstream. It's rare but serious. Or, in the case of parasitic meningitis, something as simple as swimming in freshwater lakes could expose you to Naegleria fowleri, an amoeba that causes severe infections. The point is, meningitis is not a one-size-fits-all illness. The cause can dictate how fast it progresses, how deadly it is, and what kind of treatment you'll need. Diagnosing the invisible enemy. So, how does a doctor figure out whether you're dealing with meningitis or something else entirely? Since the symptoms are easy to confuse with other illnesses, diagnosis can feel like solving a puzzle. The biggest clue comes from the cerebrospinal fluid, CSF, the liquid that surrounds your brain and spinal cord. A simple lumbar puncture, or spinal tap, can reveal if meningitis is present and what's causing it. It's a definitive test that doctors rely on, but before getting to this step, they'll consider other clues from your blood tests, CT scans, or MRI to rule out other possibilities. Treatment, a race against time. Now, let's talk about what happens once you've been diagnosed with spinal meningitis. Treatment looks different depending on the cause, but here's the thing: time is everything. Viral meningitis, usually, this resolves on its own with rest, hydration, and over-the-counter medications for pain and fever. Your body, given time and care, can fight off the virus. Bacterial meningitis, this one needs a full-scale medical assault. You'll get intravenous antibiotics as soon as possible because every minute matters. Doctors might also give you corticosteroids to reduce inflammation and prevent damage to your brain. Fungal meningitis, you'll need antifungal medications, which can take weeks or even months to clear the infection. It's a longer battle but manageable with the right treatment. Parasitic meningitis, treatment here depends on the parasite involved, and it's often tricky, requiring specialized medications. What happens next? Recovery and long-term effects. Here's where things get complicated. For some, meningitis leaves scars that aren't visible. Bacterial meningitis, in particular, can have lingering effects. Survivors may experience hearing loss, learning disabilities, or even seizures. It's not just about beating the infection, it's about the long road to recovery. But here's the good news, with early diagnosis and treatment, many people recover fully, especially in cases of viral meningitis. The key is catching it early before it has the chance to cause permanent damage. Does meningitis affect you later in life? For many, the fight isn't over once they leave the hospital. Especially for those who've had bacterial meningitis, the impact can stretch far into the future. You may have trouble concentrating, experience memory issues, or notice problems with balance and coordination. Some people develop hearing loss, and in rare cases, survivors might struggle with seizures for the rest of their lives. But this doesn't mean that recovery is impossible. With support, many people can rebuild their lives, and some may fully recover without any lasting effects. How to protect yourself? Prevention matters. Meningitis may sound terrifying, but there are steps you can take to protect yourself and your loved ones. The most effective way is through vaccination. Many of the bacterial types that cause meningitis can be prevented with vaccines, like the meningococcal vaccine or the pneumococcal vaccine. Staying up to date with vaccinations is one of the most powerful tools we have. Simple hygiene practices also help. Washing your hands regularly, avoiding close contact with sick individuals, and maintaining a healthy immune system can go a long way in keeping the illness at bay. Final thoughts: meningitis is a serious threat, but you can fight back. Spinal meningitis can move fast, but knowing the signs and acting quickly is your best defense. It's more than just a bad headache or a fever, it's a life-threatening condition that requires immediate attention. Whether viral, bacterial, fungal, or parasitic, understanding how meningitis works and what steps to take can save lives. So, if you ever notice these symptoms in yourself or someone you care about, don't wait. Seek medical help. Early diagnosis and treatment can mean the difference between a full recovery and lifelong complications. Stay informed, stay protected, and don't ignore the signs your body is giving you.